Hi, everybody. Jack O'Malley with a Friday update. Thoughts on the passing scene. Thoughts on the passing scene. Let me start with, I saw in the news today, one of the first things when I opened it up, see what's going on. Harry and Meghan are no longer official royals. I'm sure the people in England care, but this one resident of the Fighting 101 don't. God bless them. Go for it. But I get a kick out of how we follow the royals. It boggles my mind. I guess maybe it's good escapism. I don't know. All right. A couple of thoughts on some things. Yesterday in our oversight committee, we had restaurants in hotels and in convention locations. And it was heartbreaking. These folks are running businesses and they have been targeted. And in the state of Michigan, so I had a call today, a story. He said, here, you can use this story. Valentine's Day, he and his wife always get out of town for a little bit. They go somewhere, spend the night in a hotel room, have dinner, breakfast, do a little shopping, just to get away together. Well, they didn't want to have to wait in lines and wonder who was open and who wasn't. So they went into Indiana so that they could easily go to dinner, get a hotel, do some shopping, and not have to worry. And that just gives you a feel if you're not, again, I'm speaking to those people in the middle who think that everything we're doing is absolutely right. And yesterday, I'm listening to these hotel folk, or these restaurant folk, and they're talking about how good longtime employees are going to get jobs at box stores because they know they got a job there, and there's hundreds of people in that store, and they're going to have the job. Same restaurateur telling me that a longtime employee lost their home because they couldn't make the checks, right? Make the payments because they lost their job. And the money that they've spent trying to follow the rules only to be pushed down. And I have been talking about our small businesses being hurt left and right. And, restaurants and bars have become the poster child for this, but it makes absolutely no sense in the world. And the good people at the Michigan Restaurants and Lodging have come up with a plan that they've submitted to the governor with real metrics that say regionally, when regions hit this certain level, let us go to this, let us go to that. And their contention is that they could be open at 50% at least in every market in the state if we did this correctly. And I can't guess as to why the governor is doing what she's doing. And I can't guess as to why, well, actually I can guess as to why the medical community is doing what they're doing. And I'm going to get to that in just a second. But once again, extending the 25% to March 29th from the February 21st line. Governor, what the hell are you doing? All the metrics are down. I don't have it right in front of me, but we're at the lowest point we've been since the beginning of November. Open it up. If we have a region that has a massive spike in the hospitals, they're stacking them out in the hallways, then we deal with it then. But that's been the problem with this whole COVID thing. There's no freaking balance. Nobody said this was going to be easy. Nobody. Pandemic, haven't had one in 100 years. We don't know what it's going to happen. But we went to the ultimate as opposed to trying to say, all right, we do have to balance wellness with people's livelihoods, the state's economy, the mental health issue, et cetera, et cetera. People trapped in nursing homes. We have to balance it. If we were, and we have gone strictly to the COVID patient with poor effort on everything else. And I saw this article in the Wall Street Journal, and there were some very interesting articles. This is just the author's opinion. And from what I could tell, he's a guy who's been studying this. He's talked to experts, et cetera, et cetera. So from the Wall Street Journal, not some crazy website, Joe's Thoughts on the World, The Wall Street Journal, this author says, cases are down. This is nationally, not just Michigan, but nationally. Cases are down 77% in the last 6 weeks. The question is, why? And it's faster than what was predicted. He says, in part, it's natural immunity from prior infections. It's more common than can be measured. Natural immunity. There is some thought that some people who never had it but were exposed have immunity as well, right? Interesting. People are getting vaccinated now, currently at 15% in the country. So that has brought the level of people who are safer from COVID up. And that number is rising every day, which is good. Those infected, most had mild symptoms, but they now have antibodies. This is another interesting thing. He addressed a report of Spanish flu survivors that were followed up on 90 years after the flus. They had it. So, back in the early 2000s. Those folks still had antibodies from the Spanish flu. The body is an amazing thing. In Sweden, I know when they bring up Sweden, people go, that's Sweden, that doesn't count. They're crazy. The world's going to nuts. Sweden actually did it right, folks, my opinion. But his comment was, in Sweden, they found that antibodies in people who never got it but were exposed. I mentioned that earlier. Never had it. But yet they have the antibodies. Why? Because somebody in their house had it. They were exposed. They got the antibodies. So what's going on here? The author says, I have noticed that too often it's dismissed natural or herd immunity, arguing that we don't have enough data. The data certainly doesn't fit the classic random controlled model to gauge to the old guard medical establishment. It says there's no control group, but observational data is compelling. And many have mentioned the term herd immunity, and when that has been brought up, they have been vilified. How stupid, how ignorant, how inhumane can you be? Because you're talking about herd immunity. You want people to get this illness? No. But it's commonsensical. It's life. Some of us will get it, and when you do, the cases are mild, or you have it, you didn't even know it, or you get immunity even though you never got it, just because it came in, you never got sick. All those things equal to herd immunity. So this author is saying that some are predicting that we could be at herd immunity as early as April. Now, I'm not going to go there just yet, but think about that. And I think part of the problem here is twofold. This is just my opinion. When it comes to the higher level, I'm not talking about the on-the-ground docs who are taking care of sick people. I'm talking about this group up here that supposedly our governor is talking to, and this group up here that's on the national level. They're old guard. They want to have that controlled group. They don't know. And I get that. But remember I was talking about balance, just the illness and everything else? Think about it this way. Let's change the scenario for just a moment. Why do we have a civilian commander-in-chief? Why do we have a civilian Secretary of Defense and not military? Why isn't just the military in charge of the military? Because we want to have civilians deciding what to do. You know, in theory, the military is, let's go, bayonets, right? Let's attack them. We can do it. That's the theory behind, no, we want civilians in charge. So let's put that now to the war on COVID. Isn't it up to the civilians to take that advice from the medicals? And I'm talking about the upper echelon. I'm not talking about the doctors and nurses in the hospitals. I'm talking about these decision makers that are talking to the governor and these decision makers that are talking to the presidents. And say, wait a minute here. I have to balance the medical advice. Who's gung-ho? We got to do this. This isn't how we do it in medicine. And say, I got to balance that with my people. Why? Because our system is set up where a civilian is in charge. So think of that Dr. Fauci as the Secretary of Defense or the general, Petraeus or Schwarzkopf or whatever. I'm coming from memory. Think of them as that general. Do we want them making every call? No, we're supposed to have civilian thought process in there. So, a very interesting article from the Wall Street Journal, something to think about as we move forward. Our old guard medicine, stop and think a little different. Governor Whitmer, President Biden, think about this as you're making these decisions to balance it. Don't just take what they're saying hook, line, and sinker. Use anecdotal evidence as well because it's out there. You don't have time for a control study, so you have to make calls. I'll give you one. Suicide. I've heard from the Department of Health and Human Services, I see that, through July, our suicide rate's about the same. Yeah? Well, talk to the medical examiners. Talk to the doctors. Talk to the firefighters who are going to the attempted suicides in the homes. They're going to tell you a different story. That might not be what's in a report that's a year late, because they don't really tally suicides until well after the year. But you're in a battle. So get that report from the field. We're not doing that. Or if we are, we're only taking it from one group. And that's the old guard who only thinks, and rightfully so, I want them thinking medical. I do. But I want the civilians who are in charge to be looking at everything. And that's why I say we're out of balance. Just my thought. I'm one guy. It's a Friday. I hope you have a safe weekend. I hope you have fun. It's winter. If you can get out and play, please do so, but do it safely. All right? Let's be safe out there. Let's keep praying for each other. Have a good night.